Thank you. So I'd like to welcome you all to this meeting of the Health and Wellbeing Board being held on Monday the 16th of September 2024 for fire and emergency evacuation. For those present in the meeting room, if a fire alarm sounds, please leave the building by the nearest exit and make your way to the fire assembly point in the car park. Papers and recording. The agenda papers and other relevant information for this meeting are available for public viewing on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and is making a recording. For participants in the room, please use the microphones to speak, pressing the button on the right of the unit. Please speak directly towards the microphone. Otherwise, your contributions may not be picked up on the live stream. Please ensure that mobile phones, laptops and other devices are turned to silent. Others are permitted to film, photograph and record public meetings, provided that it does not disrupt the business of the meeting. If there are any members of the public, which there aren't, present who do not wish to be filmed or photographed, they can raise their hands and we will make sure that that doesn't happen. Procedures and etiquette for the meeting. Only committee members present in the room may vote. For people in attendance as virtual participants, can I request that they use the raised hand feature within the system if they wish to contribute and to introduce themselves when they are called upon. Right, we now move on to the agenda. So the first item on the agenda is apologies for absence.
Thank you, Chair. We've had apologies for absence been received from board members John Butlin of Hereford and Worcester Fire and Rescue Service, Kate Mark Carmichael of Herefordshire Council, David Mahaffey of NHS Herefordshire and Worcestershire Integrated Care Board, Christine Price of Health Herefordshire, and Tina Russell of Herefordshire Council. And I note that Stephen Brewster, our voluntary and community sector representative, hopes to be able to join the board remotely a little later on, as does Superintendent Helen Wayne. Hopes to join remotely, and also note that we have Kevin Crompton and Sue Harris are in attendance remotely also.
And I think just to mention that with regard to Tina Russell, because of her recent appointment to the authority and the way that the agenda was put together, she unfortunately didn't receive sufficient notice to be able to attend today. So we will have corrected that and we'll make sure that she can do so in future, won't we, Ben? Okay. Is anybody aware of any other apologies? No? Can I ask the clerk if substitutes have been notified?
Yes, we've got some substitutes that are kindly present. So Anna Davidson, Assistant Chief Officer and Director of Prevention, Herefordshire and Worcestershire Fire and Rescue Service is in attendance for John Butlin. Rob Davies, Consultant Public Health, in attendance for Kate Carmichael. We have Dr. Andy Watts kindly in attendance for Christine Price from Health Watch Herefordshire. And we also have some Trickett's present in the stead of Dave Mahaffey for the Integrated Care Board.
Fine. Thank you. So we now move on to declarations of interest. Do any board members wish to declare any interest in any agenda item? No? Okay. So the next item is the minutes, to approve and sign the minutes of the meeting held on the 10th of June 2024. The minutes documents of the meeting held on that date are included in the agenda. No matters of accuracy have been notified to the monitoring officer. Are you content that I sign the minutes as an accurate record? Yes? Fine. I'll just sign them there. We now move on to item 5, which is questions from members of the public. No questions have been received from members of the public. The next item, item 6, questions from councillors. No questions have been received from councillors on this occasion. So we therefore move on to item 7, which is the Herefordshire Better Care Fund, which will from now on be known as BCF. Integration Plan 2024 to 25, and the purpose is to update health and wellbeing members on Herefordshire's Better Care Fund integration plan and seek formal health and wellbeing board approval. The covering report recommends that the Herefordshire Better Care Fund 23-25 Planning Template Appendix 1 and the ICB Discharge Template Appendix 2 submitted to the NHS England be reviewed and retrospectively approved, and the ongoing work to support the integrated health and care provision that is funded via the BCF is noted by the board. And I ask if anybody in the room would like to ask any questions on that particular report or make any comments.
We have Hayley Doyle, who's joined us remotely kindly. If there's
Oh,
anything she
Hayley,
wishes
would you like to present this report?
Yeah, hi, Councillor Gandy. Yes, I'm happy to just run through some of the key points, if that's okay with everybody. And just to introduce myself, I'm Hayley Doyle, I'm Service Director for All Age Commissioning, and the paper that you've received today, as you've just outlined, is to seek the retrospective approval of the 24-25 plan. As you are aware from previous meetings, unfortunately, the national timescale doesn't always meet our timescales in relation to Health and Wellbeing Board, which is why it's being presented retrospectively. And the plan was submitted in June. So the purposes of the Better Care Fund are to ensure spending on social care services to benefit health and improvement, overall health and social care outcomes, and to facilitate the smooth transition of people out of hospital and reduce the chances of readmission and support people to avoid long-term residential care. It is a requirement of all health and wellbeing boards nationally to submit an agreed Better Care Fund plan, with the aim of working towards two core programme objectives, which are to enable people to stay well, safe and independent at home for longer, and to provide people with the right care in the right place at the right time. In terms of where we currently are in Herefordshire, we are currently in the second year of a 2-year Better Care Fund plan, and that plan ran from 2023 to 25. The full Better Care plan was submitted to this board and assured and approved on 25th of September 2023. And the requirements for this year were to refresh elements of that plan, and that included refreshing elements around the metrics, the discharge planning and capacity and demand estimates for discharge, and for us to confirm, based on the final Better Care Fund allocations, the spending requirements for 24 and 25. There was no opportunity at this stage for us to refresh the narrative plan submission. So you've got at Appendix 4 the approved 2-year plan that was submitted last year with the narrative elements, and that still applies at this stage. So we did receive the national guidance fairly late this year, which gave us very tight timeline to be able to respond to in terms of doing the required updates. And that's why it wasn't possible to bring its health and wellbeing before. But just to note that the work that we've done on the refreshes to the plan have been approved by One Herefordshire Partnership, Herefordshire Council and Herefordshire and Worcestershire ICB. The refreshed plan includes updates on our spending plans, and the changes to the spending plans are a result of agreement to vary spending plans and based on the confirmed allocations for this year. We have done significant work on updating the capacity and demand planning and revised our ambitions for the national metrics, and ensuring that we continue to demonstrate value for money across the system. And just to note that the West Midlands Assurance Panel for BCF has recommended approval of our refreshed plan at this stage, and we will confirm following this meeting if Health and Wellbeing Board are able to approve the plan. So the national conditions remain the same as we've updated on previously, and we are still required to set local ambitions against the 4 metrics around avoidable admissions, falls, discharge to usual place of residence, and residential admissions. And just to note that Department of Health and Social Care have also flagged their intention to introduce additional metrics around discharge and reablement for 24-25, but as of yet, these have not yet been published. The paper that you have in terms of the summary paper also contains some detailed element around the funding summary for the Better Care Fund and how we're using the fund for 24-25. But just a few key points to note: that overall the Better Care Fund has increased in terms of our allocation by 2.6 million. However, we do have a position where we have already fully utilised the previous Better Care Fund reserves, so that funding is no longer available to us. And as of yet, the government haven't announced any local authority urgent or emergency care funding for 24-25. So in terms of taking that picture together, the net effect of changes is an increase of 0.3 million in funding, which means that that is insufficient to meet inflationary increases in the recurrent commitments within the plan. So we do need to look at reductions in some of our expenditure, and that's necessary to deliver a balanced plan. So a lot of the funding is committed to core services running recurrently, so we do need to consider our longer term planning, and there's ongoing work in relation to BCF and how we use this for the future. We have moved some pressures to council budgets in relation to the IBCF, and expenditure on discharge services is where we have the most flexibility to make changes from a financial perspective. And we have established a working group that has been in place since we got the national guidance across the council, Wye Valley Trust and the ICB to take this work forward. The majority of our spend on discharge is through placements to facilitate discharge, some of which are spot purchased and some are delivered through our contracted services across the system. So we have had a real focus on how we integrate these services and make better use of these services. And alongside that, we've done significant work around the capacity and demand planning, which has been introduced as a requirement of the Better Care Fund since 2022-23. And is now an integral part of the planning factor for future years. So in terms of the work that's been underway, we've developed a considerable amount of work around increasing the capacity in the contracted services. So this includes working with Hillside and Ledbury intermediate care centres to increase occupancy levels and reduce lengths of stay, increasing contact time within our Home First service, continued use of the bridging service, and contracting for bedded care where possible at a rate closer to the council's contract rate rather than spot purchase costs, and reducing the length of stay in short-term home care placements. And there's been a significant focus on looking at our discharge to assess pathways and how we eliminate delays in that discharge from acute beds. The paper contains a summary of the capacity and demand plan, which reflects the work around our contracted services and gives us some targets around those areas. These are realistic but ambitious, so could be challenging to deliver. But we are continuing to monitor the plan and the progress against those targets through the Discharge to Assess board. So the paper does summarise the plan and its changes, and just important to note that in terms of the Better Care Fund implementation and delivery of its services, we continue to report through the Integrated Care Executive and onwards up to One Herefordshire partnership on an ongoing basis, and we have that significant amount of work going on across the system, working collaboratively to deliver the plan.
Thank you,
take any
Hayley.
questions.
Thank you. Any questions? I'd just like to make one observation which I don't quite understand, which is on page 27. It's a minor thing, but I just don't understand it. It's the first paragraph down, funding and sources, where it shows a difference of £1, but the figures are identical. And I don't understand it.
That ends with an 8 and that ends with a 7.
Yeah, but they are the same.
Oh, I see.
So I don't quite know what happened there. I am right, aren't I?
Rounding, I would guess.
Just trying to pull it up.
It's page 27, better funding update template, income and expenditure, funding sources, and the totals are 29,957,000, and they're both one is £1 different to the other, but the actual income and expenditure in the document is identical. So I don't understand why there's a £1 difference.
Why there's a difference? Councillor Gandhi, Adrian's had to give apologies today, so our finance lead. So if I query that and come back with an answer, is that okay?
That's absolutely fine. I mean, I'm sure it's probably an error, but it just looks a bit strange. And the other thing, I recognise the fact that you haven't been asked to actually refresh the plan itself, but obviously there are things within the plan which are no longer actually happening or relevant. So, for example, there is a mention in the plan about Talk Community Super Hubs.
Yeah.
And we are not now looking at Talk Community Super Hubs. We are looking at doing more with Talk Community Hubs, and we're putting more money into Talk Community Hubs. But we're not looking at having specific, identified super hubs. And I think that really ought to come out.
Yeah. We weren't able to, we didn't have the opportunity to update them out.
I understand that.
Yeah, but that doesn't mean that we can't change our kind of operational delivery in terms of how we meet the outcomes in terms of the plan going forward.
Yeah.
But I take your point about taking that out, and I'll follow that up. Councillor Gandhi.
All right, thank you. Simon.
Yeah, thanks, Chair. I just wanted to add, really, I think that we've had a really good 12 months with this Better Care Fund. We're probably in the maybe 11th or 12th year of having a Better Care Fund. Certainly for the Herefordshire one, I think we've had the most proactive and successful 12 months because the teams leading it, and Hayley's part of that, as are Jane and John and Hillary's staff, they've really seemed to have gotten to grips with what we can do to make the biggest difference. I think there are financial pressures in there, as Hayley described, but what I'm more reassured by is our capacity and capability to manage those financial pressures. I just feel there is a visibility to what this thing is doing, the impact it is having, and I feel like it has been much better managed. And it's been better managed because it's devolved down to the One Herefordshire structure. So for me, this is the thing the One Herefordshire structures are probably making the best job of. There's lots and lots of good work, but this is a very tangible, there's tangible evidence here. This is making a big difference. What we will hope to see, I think we've reported it here before, but for the last 2 years, we've done a point prevalence audit, which is, we take a day, and it's actually Wednesday, the 18th of September, and it was a similar day last year and the day before. We look at every patient and service user in a bed or in a package of care in the system, and we work out where they are on their journey. Are they delayed? If they're delayed, why are they delayed? And actually, the Herefordshire picture hasn't been particularly positive over the last 2 years, certainly when compared to the neighbouring county. I think this year's audit is going to show a much improved picture, and the reason for that will be the work that's happening with the Better Care Fund. So I'm sure the board will want to hear the results of that when it's available in a month or two, but that's a really good temperature check as to whether this is working or not.
Hi, I'm Andy Watts. Thank you, Simon. I'm reassured by that. I just wondered if within all this work, there's any, if we're capturing feedback from service users at all in terms of the quality of discharge planning and what happens to them after discharge. It's quite a precarious time, that first 48 hours after discharge, and I just wondered if whether there was any ongoing metrics or any ongoing system to look for service user feedback.
I think I think
Go on.
I think the short answer is we don't do anything formal in terms of seeking feedback. I think it's a good point, and I think we need to think about how we do it. We probably do it later in someone's pathway out of hospital, if that makes sense. So when they're well into a discharge to assess process. But I think there is something more we can do in a more systematic way. And we'll certainly take that on board and build that in.
Amy, did you want to add? Hayley?
Yeah, just to reiterate what Hilary was going to say, and that I was going to say very similar. I think there's more that we can do. I think we capture the voice later in the process via a variety of mechanisms. We don't have a formal metric around that, so I think there's more that we can do and take away in relation to
So we could put that as a recommendation. Yes. Thank you. Jane?
Thanks, Hayley, and thanks, Simon. There's no doubt we have seen some improvement. It's not our best week this week, so it's not going to show quite as much. I don't think when we get to the audit, but it'll certainly be there for Herefordshire. We have very significant problems with discharged into Powys. I guess my question, Hayley, is we've got. For this year, our plans are predicated on productivity improvements, particularly in Pathway 2 and Pathway 3. It's just about your level of confidence that we're going to be able to get those in place prior to winter.
Yeah, so we've already seen some changes, Jane, some significant changes in terms of increasing capacity, for example, with Home First. We continue to work in that way, so we are continuing to work very closely with the providers, and colleagues in health are continuing to work with Ledbury Intermediate Care Unit around their specific contract elements and increasing the capacity there. So there is still a way to go, and we continue on that journey, but we are seeing some of those increases come in, Jane, so we'll just continue with that.
I'd like to ask. I recognise that you are having difficulties at the moment with Powys and discharges back to Powys. The impact upon that, from a CQC point of view, could be significant. Do they take into account the fact that you are dealing with a different country?
I guess from the CQC point of view, no. Because they are looking at the standards on the day that they see the causes of those things, they will comment on.
You don't put a Welsh flag over
but no, that's it's not really taking into account in that sense. They're really there to look at the quality standards. There is a financial impact which Simon's very aware of in terms of making sure that the resource that's being used is being appropriately remunerated to the trust, which there's still some work going on with.
And are we doing?
There's a lot of work going on, and as Jane said, that work splits into two halves really. One, making sure our friends in Powys pay appropriately the costs of the care of that their patients are receiving, and secondly, as Jane said, when the patient is ready for discharge, actually the work that we've done on the Better Care Fund here and discharge to assess pathways that are more efficient, it shows up really that the patients in Powys aren't getting the same experience. So we're working really hard with Powys Health Board in particular, but the councils as well, to try and help get some more consistent pathways. It's interesting, I think, Jane, over the summer we had a better month or two, John Barnes told me. There's actually a couple of former members of Jane's team now work at Powys councils, and that's helping because the personal relationships and links are there. But again, when I spoke to John a week or two ago, it wasn't as good again. So we have seen some signs of progress, but we need more consistency. We will carry on lobbying and campaigning to make sure both of those two sides of that coin are resolved, both the financial and the operational, because there is not the slack in the hospital system to absorb this level of delay, and it's not good for patients. It's not good for the patients who are delayed. It's not good for the patients that are waiting to come into hospital beds but can't because of that. But it's a problem all over the country. It's a particularly acute problem with the cross-border issue we find, and I know colleagues in Shropshire have similar difficulties and frustrations as well. So actually there are conversations with neighbouring authorities as well to make sure we are sharing best practice about the best things to do to resolve these things.
Anybody else got any questions to ask about Better Care Fund? No? Right, when we go back then to the recommendations at the beginning, which were that the Better Care Fund 23-25 planning template Appendix 1 and the ICB discharge template submitted to NHS England be reviewed and retrospectively approved, and the ongoing work to support integrated health and care provision that is funded via the BCF is noted by the board with that recommendation, which is...
Yes, indeed. We requested that the director give consideration to a metric for feedback from service users, following
Yes.
Dr. Watt's point, and also think I think Trickett mentioned that the board may want circulated sort of an update on the point prevalence audit in due course.
Yes. Yes, please. Okay. All those in favour? Any against? Any abstentions? No, that's fine. Okay. We move on then to item 8, which is the update to the board on the Best Start in Life action plan.
Good afternoon, everybody. Julia Stevens, Public Health Lead for Children and Families. It's a delight actually to bring this back to you. When I first came, it was back in March, and a considerable amount of work has been carried out behind the scenes since then. If you've had chance to look at the paper, and in particular the implementation plan, you'll notice that it's laid out with a RAG rating of red, amber, green. And you'll probably note that we've got quite a few greens and ambers and very few at this stage of reds, although the ambers and some of the reds are proving some challenges. But what I thought I'd do for you today is, I don't want to go through every single target with you because that would be quite laborious, and I'm sure that you know, in your own time you can and probably have read through this. But what I am going to do is I'm just going to pick out a few highlights and a few challenges for you to give you a flavour of what this work looks like on the ground. Just to remind you that the Best Start in Life is about our young children, so it's our 0 to 5 population, and you know what it says on the tin, it's about making sure that they have the best start in life so that they can have good outcomes into adult life. So just to give you a few highlights, we recommissioned our 0 to 19 public health nursing service last year, and we have a new contract and a new service specification that was launched April the 1st this year with our partners Wye Valley Trust, who deliver that service. They have a number of targets within this action plan. They are working at the core with our 0 to 5-year-olds, especially our health visiting service. And one of the highlights that's been developed since they started delivering the new service specification is that we've integrated health visitors now within PCNs, and they actively now contribute to those PCN meetings in the locality. So what that does is it brings the children and families agenda to those PCN meetings where it wasn't there before. And we think that's fundamental in making sure that we have an integrated system and that we have integrated partnerships because as we know, children and families have adults and parents. It isn't just the adults that we need to look after in the communities, it's the children and families and the adults. It's a holistic approach. So we will monitor that with interest to see how that develops in due course. But I think that's been welcomed by our health partners, it's been welcomed by our GP leadership team and One Herefordshire, and that's going to be an interesting development moving forward to ensure that we are developing integration, real integration across the system. You will also be interested to know, those of you that have probably suffered with me for many, many years over our challenge over oral health with our young people, in that we have now secured 2 new dentists in Herefordshire, 2 new NHS dentists, I might add. So we have one that has set up on Commercial Road in Herefordshire, in the city, which is open and actively taking patients. And we have another one that's in development. I don't have a date for the opening of that one, but that is at South Y. The name's escaped me. It's in the paper. That's it. Thank you, Councillor Gandy. That one is starting up at Saxon Hall. So in an area of great deprivation, as we know, so that will sort of really hopefully tackle some of our issues around inequality and oral health. So that is a huge development that we've been working with our Oral Health Improvement Board and our NHS improvement partners regionally and nationally. So that's a really good development. And obviously that we hope in time will have an impact on the work we are doing around prevention of oral health with our children. Our supervised toothbrushing scheme is still operational, and 43 schools across Herefordshire are delivering supervised toothbrushing, which basically in reality means that they are brushing children's teeth in the middle of the school day. And that, of course, we know will have an impact around prevention, because we hope that if they aren't brushing their children's teeth at home at least once a day, they are at least brushing them within the school or nursery environment, which will have an impact on the health of their teeth and hopefully less cavities in due course. So that's some 2 really good examples of some highlights. Another one I want to focus on is the 4 to 6 month oral health and weaning check that we have brought in to the 0 to 19 public health nursing service contract. That used to be in the contract a couple of years ago, and then the funding ceased, and we reintroduced it as part of the new service specification when Wye Valley Trust won that tender again. So as from the 1st of April, that 4 to 6 month oral health and weaning check has been developed and is now up and running. The slight difference is that that takes place within the community, whereas previously it was in the home of the children and families. So now the service run community 4 to 6 month health and wellbeing checks where parents are invited, and they are obviously given workshops, information, advice and prevention around how to look after your children's teeth from that very early age, and equally around weaning and healthy eating and food, which of course the 2 go hand in hand. So that's another highlight of the plan. I just want to draw your attention, because we have to get a good balance here of some of the challenges that we're facing within the plan, because it isn't all necessarily positive. There are challenges with all of this that we're delivering, and there are ambitions that we want to achieve, which, you know, sometimes are a challenge and a struggle. And it's important to obviously let you know what some of those are. So, for example, one of the challenges that we do have is trying to develop a cross-sector dashboard covering health services, social care, and the voluntary community sector and early years. And this is quite an aspirational challenge, because we are aware that, and you will be aware, that there are a lot of dashboards that we all have within our own pieces of work. And what we'd like to do is get a overarching dashboard for children and young people around health, social care, early years, etc. I think this will be something that we could take to the Children and Young People's Board. You will probably be familiar that that board is currently having a bit of reflection and review, and is being led now by obviously Tina our new Director of Children's Services, and of course Ivan. We're looking at the terms of reference for that, but that will be a key focus for the board, I think, in helping us to move that piece of work forward in due course, which I'm sure Ivan will probably agree with. I think one of the other challenges, just to bring to your attention, is also around the voice of families and children across actions and plans within the council and health, etc., and social care. There is no clear or consistent, and it might be that there doesn't need to be, but there doesn't seem to be a very clear strategic view on how we gather the voices and opinions of children and families within Herefordshire. Everybody does it differently. There are small teams that capture it amongst early help plans and various pieces of direct work with children and families like that, but there isn't a consistent approach or a consistent way that says that this should be done and this is the way we'd like it to be done. So that is another challenge within this plan that we'd like to address, and again that will probably one that we can also take to the Children and Young People's Board to get an idea on how we might be able to develop that further across the system, and with some ideas on how that might look. Just bringing your attention to the one and only actually red ragged section in the action plan, just to bring your attention, and that is around broadening the early help and start for life offer within the community. The development, and Councillor Gandy mentioned this earlier, of our community hubs has since the Talk Community Review come to a bit of a halt, because we are looking at how those hubs need to be developed in the future, what realistically they can deliver. And that's part of the Talk Community Review, and you know, the progress for the Talk Community team, now they've moved across to public health. There's an opportunity there on how we work better and closer with our communities and community and voluntary sector to work on developing this target within the plan, because we would like to see more of a community-based focus coming out of these Talk Community hubs, if they prove to be the place where our children and families want to go and access that information. So that's a challenge for us. We are awaiting the outcome of talks with the Talk Community team, now that they have, you know, very recently moved across to public health, to look at obviously their work plan over the next 12 to 18 months, the recommendations from the Talk Community Review, and how we might develop that further. So that's just to give you an update really on why that's red and what we're going to do to try and solve that solution. So I won't talk anymore, because I could talk you to death about all of this, and I just wanted to just give you a flavour, because I'm sure you've probably got some questions about some of the stuff that you might have read. But thank you.
I open to questions. There's just 2 points I wanted to make. Yeah, I'm delighted that you've got 2 new dentists coming. It still doesn't satisfy my desire for what we're going to do for the rural areas, which are the majority of Herefordshire residents live in, because we actually, these are both really based mainly within city limits with good bus services, etc. So we are still struggling with the rural areas where we just do not have the dental availability, and we don't necessarily have any public transport for people to get to the dentist. And I've talked, I don't know how often, about possible mobile dental options, and I think I first mentioned it 8 years ago when I was chair of the Children and Young People's Scrutiny Committee, and I've raised it several times since then, that if we can take other things out on a mobile basis, why we can't do that sort of thing, because certainly as a councillor that represents a very rural area, a lot of my residents only have one vehicle that is used by the main breadwinner, if you like, and a wife or a mother or a father needing to take a child to a dentist in Leominster or somewhere like that doesn't have the public transport in order to get there. So we don't seem to be addressing that, and therefore you've got, I think it's at least 2/5, if not more, of the county that is still not being served as well as they could be. The other item is the red item. I don't understand the reasons given for this being red. Talk Community from the very beginning, and it was never ever going to change, was to do with health and communities and improving health and trying to avoid access of children having and adults having to go to hospital, be seen by adult social care or children's social care. That was never going to change, whatever the review said. And so therefore I don't understand why the work that was going on previously has come to a sort of standstill while the review is taking place. This was never going to be a major thing where we were going to close community hubs down. This was about just re-looking and trying to bring them back to what their original aim was. So I don't accept the reasoning behind that. And I think Hilary might like to make a comment as well.
And thank you, Chair. I was just going to say, I think this is something I want to take up with Tina Russell, because I think this is very much about the work she's doing to around early help services. And I know that she's had a lot on her plate since she's arrived, but this is part of that work rather than the Talk Community Review, which I think is something very separate to this. So I think if I can take that offline with Councillor Powell and Tina Russell and pick that up.
I think it's important to say at this meeting, because it is within the public domain, that there is nothing that Talk Community is doing or has been doing in the past that, as to my knowledge, has stopped as a result of the review. Things have continued as they were. What we are intending to do is to actually do more rather than do less. So that is the message that needs to be taken back by everybody that's involved with Talk Community, that's what we're intending to do. We're intending to do more. Okay?
Just to respond to that, Councillor Gandy, and apologies if this wasn't clear within the plan. The reason why it's red is it isn't because Talk Communities haven't been delivering on the aspirations of what they of the hubs. We know that we've got a huge amount of hubs across the whole of Herefordshire, and they range from village shops, village halls, pubs, community centres, etc. The aspiration within this particular 0 to 5 year Best Start in Life plan was that what we wanted to try and be aspirational in is that we wanted to try and build into some of those hubs health room spaces where health visitors could potentially see a family from a Talk Community hub. And that is the challenge that we've had, because the majority of those community hubs don't have the facility for us to work within a clinical health space. So which of course I'm sure you could appreciate, if your local village shop is a Talk Community hub, they're not going to have space necessarily to be able to have a consultation room for a health visitor weigh-in clinic, for example. So that's the challenge, Councillor Gandy. I think aspirationally, I think we were hoping that there may be funding where perhaps some of our super hubs, if that was the route that we were going to go down, may develop health spaces within those community venues. But as we know, that isn't the case for Herefordshire at the moment, and that's why this particular action is marked as red currently. I don't know whether that helps a little bit in the understanding.
Yeah, I think the previous point, if we could take this offline, and we'll deal with that with Tina and Councillor Powell.
Thanks, Julia. So I welcome all the work that's been done. I'll catch up offline, I think, because I certainly agree with you. Being the chair of the Children and Young People's Partnership Board, much of this that we can have a more detailed focus and discussion on there. It's a really minor point, this, but I think it's important. Councillor Gandhi mentioned 2 new dentists, and it's colour-coded green. I'm not sure if that's we needed to commission 2 new dentists by a certain date, and we've achieved that, which is slightly different to actually what capacity do we need and when might we get there. So we'll take all of it offline, but I certainly welcome the opportunity to take the discussion to Children and Young People's Partnership Board. And just an appeal to this board, if I could, as systems leaders, the point that Julia made quite rightly about capturing the voice experience of children and families, it strikes me that we've been wrestling with that for quite a long time. And so my appeal to you would be that when your representatives go to the Children and Young People's Partnership Board, they come with permission to go back into each of the organisations to kind of drill down and understand exactly what is going on. It may not be perfect. Christine Price from Health Watch has been endeavouring to gather over the period of time exactly what each service is currently doing, and we're not making much progress. So just an appeal to board members to support that from your respective organisations, please. Thank you.
Thompson.
Thank you, Chair. Yes, excellent to note that there's the rollout of the toothbrushing programme and the news about the 2 new dentists, accepting the Chair's point about the rural areas. But I think I'm just curious to ensure, well, I'm curious to know, ask, and then to ensure really that making it aware that you need to brush your teeth and here's a toothbrush and what have you and see the dentist is part of the thing, and that is seen as prevention. But I don't really see that as prevention as such. I see prevention as making sure you're eating the right diet, because it's all attributable to the wrong diet where you have poor dental hygiene. And then there's another point you could similarly make about obesity. So can I ask and be assured, what's the emphasis on ensuring that eating the right diet and moderation of certain foods and drinks is the key to prevention? Then there's the preventative measures and the dentists. But really, ideally, if you're eating the right diet, you don't need to go to the dentist for all of the problems that could accrue.
Thank you. One of the programmes around the supervised toothbrushing training and rollout to schools and earlier settings, it includes around healthy eating. Because you're right, healthy eating and dental decay go hand in hand. So that process, when we're training up leaders within schools, there is it sits alongside the promotion of healthy eating and healthy food. What I didn't say, which I'm going to now because it's come up, is one of the other highlights within this report is that Public Health have rolled out the new project, which is new for us in this day and age, but has been a project many years ago within Herefordshire, and that's our Healthy Schools and Healthy Tots programme. So that is a preventative programme, and we've got over 32 schools signed up to the Healthy Schools programme, and we've got one aimed at Healthy Tots, which is our nursery providers. And that is a whole health and wellbeing programme for the whole school community, the whole nursery community, and drills down and focuses in a lot more detail around healthy eating. So we are expecting schools to have healthy eating policies, drinks policies, which might mean free flow water all day, no squash, no fizzy pops, no vending machines. We're very aspirational in our framework around the criteria for that, because we don't think it's acceptable to have vending machines with fizzy drinks in schools, which we know happens, especially in some of our high schools canteens. So that this is one of the other projects that fits alongside promoting sort of and supporting the health and well-being around the food in particular, and tackling obesity alongside.
Thank you, Julia. That's really encouraging. 30 schools, that's about 30% of our schools, isn't
We've
it?
only just started, it was only launched in July.
Right, okay. Well,
So,
that's
yeah.
pretty good
And
for...
that's just primary schools.
Right, okay. So, but I mean, it would be great to set a target then, therefore, to get as many schools as possible.
Absolutely. We have a target for high schools and we have a target for earlier settings as well. Yeah.
Excellent.
Ideally, we'd like them all working towards the programme.
Excellent, thank you.
Thanks, Julia. Well, most of it's going to be positive, but I'll start on the positive, which is, I think I said to you the other day, but just for the wider audience, that when I visited our health visitor school nurses a few weeks ago, I mean, they were really delighted with the new service and that they were doing more on the health promotion side of things rather than sort of the safeguarding things that they also have to do, and so they were really pleased and felt they were making progress. And also, as I understand it, our weight of children, it has gone down slightly in our latest figures, and that's the first time it's gone down rather than going up. So that is the real test of this, isn't it? Is it making a difference? So that was really fantastic. The other thing I would say is you started at the beginning around sort of saying, you know, best start in life is about the 0 to 5s, and I think from my point of view, and we talked about trying to set 2, and only 2 prior to the Health and Wellbeing Board, actually it was broader than that, and so for me, I think we do have to think about being more ambitious about the whole priority, and I think we have got a workshop coming up on it. I think it's absolutely right to concentrate on early years to start with. We've obviously got to get the statutory services right in terms of Ofsted, so those are priorities. But I think, you know, the health and wellbeing priority is I think a 5-year plan, and so I think we ought to be thinking much more ambitiously about what we think we put into this broader programme, which is right across all of the things that the council does and all the things that all the things the county does, actually. So, because I think it's also about the private sector, it's about businesses, it's about, you know, schools, as you've been saying, and not just early years. So I think when we have the workshop, I am keen for this to be a more ambitious programme yet than it is. And I think mental health for young people is included in the mental health priority rather than in this one. But I think the figure that I came across recently was that I think girls between 12 and 15 in the UK are the unhappiest in the OECD, which is pretty damning. But and I guess again there's some things which are going to be in the mental health priority around that, but it probably is cross-cutting, isn't it? Because it's about what we do around children's well-being. But I think that is definitely sort of the teenagers and beyond as well. Thanks.
And just to pick up on that, Jane, we are awaiting, very exciting, the results from the Children and Young People survey that has taken place this summer. There's been a huge amount of work on commissioning that and getting a survey. And I think we've reached around over 4,000 children and young people across Herefordshire. And every school will be who have taken part will be getting a report on the findings of their school community. So going back to what you said around girls being unhappy at a certain age, the results from that survey will really show us how children and young people are feeling, because it covered a whole raft of questions, really interesting questions about how they're feeling around drugs, alcohol, sex, all sorts of things. And so that will give us some really good intelligence of which to then, you know, either build into this plan or share across partners and help towards our commission services.
So,
Yes, sorry when you're not in the room, and yes, I've put up my yellow hand. So, just to confirm what Jane said, the Children and Young People's conversation around mental health has been sitting in the mental health part of the Health and Wellbeing Board strategy and the delivery plan. But it's just to remind everybody that we are seeing continued investment into children and young people's mental health, whether that's an expansion of CAM's crisis services. More importantly, I think that this particular piece of work is the emotional health and wellbeing services that are in schools, That's making a significant impact and certainly needs to mirror some of what we've just heard outlined by Julia in terms of the focus going forward. Could I also reiterate the concern earlier about making sure that we've all got the right engagement in the children and young people's partnership space? For mental health, we have an adult mental health partnership board now in Herefordshire. That's got really good engagement around the plan per se, but the children's element is running through the partnership. So we do need to make sure we don't lose sight of the focus around mental health when we're sitting in the children and young people's partnership space, please, Councillor Gandy.
I take that on board.
Just very briefly, Chair, as much as I would like Julia and the Council's public health team to take on the responsibility, it's the ICB's role to commission dental services, which is a role we inherited last summer from NHS England. Just to reassure the committee, really, those two new dental practices that have opened, NHS dental practices, I think they are the first new NHS provision in Herefordshire for nearly 20 years. We accept we're having to start from a very low base. It is just a start, and there is a lot more needed. And the rural population and that mobile service you referred to is very much still part of the plan. We're trying to think really creatively, and both of these new contracts, two new contracts, have been possible through a very creative use of the national contract and different ways that we've been able to structure the resourcing of those. We'll be looking to adapt that approach to try and meet more needs away from the two practices. Very happy if the Council's public health team want to take on the responsibility, but I doubt they will, to be totally honest.
Recommendations, which are that the board considers the report an updated action plan and progress to date, and that the board considers how to ensure that the partnership organisations are clearly cited on the implementation plan and reference it across their own strategies and plans. Do I have a proposer for that? Seconder? All those in favour? Okay. Thank you very much, Julia. We move on to item 9, which is the tobacco control, which is going to be introduced, I believe, by Natalie. Yes, thank you.
Thank you, Councillor Gandy. The purpose of this report is to update the Health and Wellbeing Board on the recent government smoke-free generation plan. I hope that you've had the opportunity to look at my report. Back in 2022, the Khan Review was developed, and this was around tobacco control in England and looking at us becoming smoke-free by 2030. Following the review in 2023, the government announced the Stop the Start, which is a new plan created for the smoke-free generation. And this was mainly looking around youth vaping, etc., and looking at making sure that by the time children were 14, they wouldn't be in a position to be sold any tobacco. So that's the target we're working towards. The tobacco and vape bill was introduced back earlier this year in 2024. And we've developed quite a few services within Herefordshire. One of those services is the Swap to Stop programme. This is through our Healthy Lifestyle Service, and this is sort of aiming at those groups that are more prevalent populations of smoking. So within Herefordshire, it would be the the manual occupation workers, and mental health as well came up quite high. So those are the areas that we're focusing on mainly. And I can tell you that through the funding that was being given towards the smoke-free generation, we've managed to develop the Healthy Lifestyles team. So we've had 3 further full-time staff come into that team who will be starting in September. We've also managed to get a team lead in as well. and a tobacco control officer who works underneath me and works with me on this portfolio. The healthy trainers, what we're aiming to do is look at Train the Trainer, which is a programme where we're hoping to train other partners in delivering very brief advice around the Swap to Stop programme and different NRTs, which is it's developing really well. We're reaching out to the rough sleepers and those misusing drugs. That's through one of the Healthy Lifestyles who's based at the Union Cafe. And also we've been doing some work with the local PCNs because through the health inequalities, the core 20+5, it has come to light that smoking is one of the prevalent key areas that need to be addressed within Herefordshire. Also, I can say that we're doing some work through the healthy schools with youths around the vaping. That's been going really well, and that's been through working through with Julia as well and her team. So the aim is that we want to train as many partners as possible into delivering our very brief advice and rolling out the Swap to Stop sort of more widely. We've done some work with the Healthy Schools team and Health Watch with students from Hereford College who they were given a project, and it was around the vape awareness project. So they developed some posters for us and did really well, and sort of just getting the messages out there really. Obviously that age and high school age are the ones we're targeting. Vaping is really prevalent in Hereford around the youths. So it's an area that we need to look at. We've also been doing some work with the Trading Standards team, and they've been tackling a lot of illegal tobacco trade, and they've been quite successful in seizing goods, etc. So I don't know if anyone has any questions, but the recommendations for this report is that we're asking that the Health and Wellbeing Board welcomes and supports the Smoke-Free Generation Plan and the announcements, and that we also ask that to promote the engagement in activity to work towards a smoke-free generation within Herefordshire. And we will also provide an annual report for the board to keep you updated with things that are going on. We've also got a smoke-free sidelines project we're just implementing. We're hoping to roll it out to fall in line with Stocktober. And we will be inviting Councillor Gandy to help us with that in sort of promoting that and attend that rollout on that day in October. I don't know if anyone has any questions for me.
Thank you, Chair. Thank you, Natasha, for that. Natalie, sorry, Natalie. Just to get my mind around certain things. Vaping has got nicotine in it, which is what the attraction is, isn't it?
Yes, it is.
Yeah, okay. And tobacco per se, it's harmful, I presume, for all kinds of reasons. But the reason why there's the desire for tobacco is because of the nicotine.
Yes.
So the initiative is to stop smoking, but isn't really the initiative in terms of health the prevention of nicotine addiction.
Yes.
So this initiative is focused on smoking conventional cigarettes, not vaping.
Yes, so the Swap to Stop programme is around a programme for adults only, and they are basically given a vape kit to replace the cigarettes and to aim to stop. So it's a very short intervention. It's not
Right.
supposed to be a long-term intervention.
Right, okay. Because I think the problem we've got is we're swapping one form of addiction for another.
Yeah.
And I think if we're focused on smoking as opposed to vaping or stopping smoking and swapping with vaping but encouraging, really the focus I would have thought would be nicotine addiction rather than the mode and medium in which it's being ingested or taken or whatever the phrase may be.
Yeah, no, you're right. But I think around the smoking and the behaviour, a lot of people, they need something in the hand. So this is why I think the vape kit was introduced. So they've got something that they're sort of using instead of a cigarette. But like I said, the swap to stop is a very short intervention. It's not meant to be long term. Whereas in terms of vaping and use, that's a separate issue because a lot of use of vaping instead of smoking. So that's very separate. So we don't use the swap to stop for use. It's totally separate.
But my point is, from a health and wellbeing board, should our initiative be to encourage people to stop using nicotine? Because what we end up doing, I mean, you only have to go down a high street in any market town or any small village or local petrol station. You've got a myriad array of vape appliances and flavours, whatnot. And so we've created another industry that I'm worried that if our strategy isn't focused on nicotine addiction, we're just going to eradicate smoking but be left with a vaping problem where the issue isn't really smoking per se, because I mean people used to chew tobacco, historically, and we had all kinds of mouth problems there as a result, and snuff and and pipe smoking, what have you. But the problem is nicotine, not smoking, vaping, whatnot. And then if we're wanting a smoke-free zone, anybody who's walked through a high town or anything and been behind somebody who's vaping, they have this massive cloud of smoke that you have to walk through. It may be scented in a way that's nicer than conventional tobacco, but that to me seems to be an issue in itself, and I think we would prefer it if we didn't separate the two. It would be an initiative to cover both, because smoking, vaping, it's fumes, whatever it is, and we're not sure, are we not? I don't know what the long-term effect of vaping is, but it's introducing something artificial into the lungs. So be interesting to see how the research pans out with that. But in terms of smoke-free, I think our initiative should be the whole approach rather than focusing on one detrimental practice and then it evolving into another.
If I can just come back on that, just to make it clear that the liquids that are used, depending on how much someone smokes, they're assessed on the amount of liquid they have with the nicotine inside. So as the person's reducing, that nicotine is coming down, the amount that they're getting, and then they should reach a zero nicotine at the end of the actual swap to stop. They'll be on zero, so that they won't be getting the nicotine. Even though a lot of people will still vape because of the habit, it won't necessarily mean they'll be having the nicotine vape. I hope that's clear. Rob.
Yeah, just to add to what's been said, I think that the simple answer to your question, Councillor Lester, is we are doing both. There's specific funding associated with different methods of eliminating the known carcinogenic and incredibly harmful effects of tobacco. So one of the mechanisms of getting more people off tobacco is into vaping. That's not the end game. It's to get them off nicotine addiction, full stop. But there's still up to 30% of manual workers, mostly men, who are smoking right now and are ingesting the tobacco and the nicotine. So part of it's acknowledging that situation as it is and stepping that risk down, and then eventually it's getting from that to a non-nicotine addiction. But we recognise for some that is the most efficient way for them to get off tobacco. But there's a separate issue about nicotine addiction in children, which is bundled up in the strategy. But that's how it's kind of come through, if that's of any help.
Susan or Sue?
Thank you. It's just to provide the board with some assurance around the point 8 on the paper, which is around the prevalence of adults living with a severe mental illness having much more likelihood to smoke. That's a national picture, but there are a number of initiatives that we're rolling out and have had in the system for some time. So we, at the moment, have had the nicotine replacement product cycle that sits at the point of admission into our inpatient units on the Stonebow, in the Stonebow unit on the county hospital site, and also anybody with a diagnosis of severe and enduring mental illness is also offered an annual health check through their GP, and that very much focuses on tobacco cessation. So just to say that there is that piece of work, then the latter is a national indicator, so we're quite heavily monitored on that across ourselves and general practice, and we're increasing the uptake on that year in, year on at the moment. So just to say that it's a recognised issue. It is a real challenge actually for people living with a severe and enduring mental illness, and so it's about making sure that we have the best approaches in place.
Philippa? Philippa?
Hello. Yeah, sorry, I was just getting myself on mute. Hi, I'm Philippa Ellis. I'm the Healthy Lifestyle Service Manager. I just wanted to come in. My service delivers the stop smoking services in Herefordshire, and I just wanted to come in on the point around the vapes. Vapes are a way for us to deliver the nicotine to our clients that are addicted, our smoking clients, our adult smoking clients that are addicted to the nicotine. It's a clean form for them to be able to access the nicotine. There's no carcinogenic chemicals within the vapes, within the solutions. They've been through rigorous testing. We've got extremely strong evidence coming out over the last 20 years that vapes have been available to inform this, and the Swap to Stop scheme and access to the vapes is very much following the government advice and guidelines, and the rollout and development of Swap to Stop. So we've had, as I say, evidence-based training around it, an update to the team, and as previously been mentioned, we do have cohorts within Herefordshire that find it extremely difficult to stop smoking for various reasons, and what we are finding now in our evidence and research is for those particular cohorts to suggest to them that they switch over to vaping as a means of switching away to a cleaner form of nicotine. We're finding we're getting much more success with that particular cohort switching away from tobacco. The tobacco itself that's contained in cigarettes, in snuff, in the chewing forms contains, alongside the nicotine, it has all the harmful chemicals and the harmful carcinogens. These aren't found in the vape solutions, and particularly the products that we're using. We're not using disposable vapes, so again we're mindful of the legislation around that. We're using rechargeable vapes, so it was just to reassure that there has been a lot of evidence and research, and we're following the current government guidance as part of our Swap to Stop scheme. But I'm happy to pick up further if anybody has any sort of more detailed questions. More than happy to spend some time going through that with anybody if they would like that.
Thank you. Does anybody? Yes.
Just to inject a note of enthusiasm, as a Health and Wellbeing Board, this is a really important initiative. We should be supporting it wholeheartedly. The smoke-free generation, I think, is a great idea. And I think a great idea that could be extended through to the vaping coming through, the uptake of vaping coming through as well. But I think as a Health and Wellbeing Board, we should just be saying, great, well done, keep going, and the more power to this, the better, because it's the intervention that probably makes the biggest difference. Certainly in my observation as a clinical practitioner over the years, this is the one thing that we really need to get behind, so well done.
Hiya, I'm Anna Davidson from Herefordshire Fire and Rescue Service. From a fire perspective, yeah, again, I welcome the initiative. Certainly in terms of reducing fires or people at risk of having a fire. We know what those risk factors are, and obviously smoking is one of those major risk factors, people smoking in bed, for example. As a service, when we go and visit somebody, if that is a risk, we can provide fire retardant bedding and blankets, for example, but ultimately want to reduce the need to do that in the first place. So again, I wholeheartedly support the initiative. Thank you.
Thanks. Thanks, Anna. It's a good prompt. It's slightly tangential, but again, appeal to the board. Councillor Gandhi and I are shortly going to meet with Herefordshire Fire and Rescue for a particular reason, and that is with regard to the extended fire home safety visits that they offer. Previous experience in Herefordshire is, despite a whole bunch of work led by the Safeguarding Adults Board, we as a county weren't making enough of that opportunity in a preventative way, certainly compared to our neighbours. So we'll have that meeting, and I'm sure Councillor Gandhi and I will send some communications round. But again, when we do so, if you could, as systems leaders, kind of own that for your particular service and promote it, it's hugely beneficial to individuals and households for a whole range of reasons, but it's also about making the best use of fire and rescue who offer that service on behalf of us all. So thank you.
Welcomes and supports the smoke-free generation plan announcements. That the Health and Wellbeing Board welcomes the report, supports the renewed emphasis on tobacco control work to reduce smoking prevalence across Herefordshire. Health and Wellbeing Board member organisations are asked to actively promote and engage in activity to work towards smoke-free generation in Herefordshire, and that the Health and Wellbeing Board members are asked to support and engage with a new Tobacco Control Alliance and the resulting Tobacco Control Plan, with reports provided annually to the board. Everybody, proposer, seconder, words in favour? Thank you. We move on then to item 10, which is the Herefordshire Community Safety Partnership update. Is Helen there?
Yes.
Yes. Helen.
Thank you very much, Chair, and apologies for my lateness and not being there in person.
That's fine.
I had an urgent operational matter to deal with. So an update from the Herefordshire Community Safety Partnership then. Hopefully everybody's had the opportunity to review the brief report, and I will just go through the highlights of that now, and then obviously happy to take any questions. So the CSP agreed new priorities for 24-27 this March, and they are domestic abuse, violence against women and girls, which are both carried over from the previous 3-year strategy, and then added into that misuse of drugs and neighbourhood crime. And neighbourhood crime is defined as residential burglary, robbery, theft from person and vehicle crime. And then alongside those priorities, the partnership has agreed cross-cutting themes of serious violence in line with the serious violence duties and our responsibilities as a partnership under that, serious and organised crime, prevention and community engagement. And in line with agreeing on new priorities, the previous Director of Public Health, Matt Pearce, led a review of the CSP and its governance structures, which was completed towards the end of last year, to make sure that we have the structures sitting beneath the CSP board to work in an efficient and evidence-led manner to deliver effective community safety. And the governance structure is provided as part of the papers if anyone wishes to review that. So the subgroups that we have in place are aligned to our priorities, and we have introduced a new reporting structure for subgroups to make sure that the CSP board is able to effectively monitor progress, allocate the funding that we have as a CSP from both the serious violence duty and also the Office of the Police and Crime Commissioner, and that we can hold the partnership to account for delivery. And one of the things that we particularly are keen to do is to seek to strengthen CSP engagement activity in our neighbourhoods, to consolidate and build upon existing engagement tools that we all use as single agencies. And that will help us to understand the impact that the activity of the Community Safety Partnership is having in local communities in Herefordshire. One of the subgroups that we've had a really good look at over the last sort of 6 months is the multi-agency and tasking and coordination group. So that's MATAC, which has significantly revised its terms of reference, scope and membership to make sure that it's a fit for purpose tactical arena to deliver against our strategic priorities, and particularly in relation to neighbourhood crime, organised criminality, antisocial behaviour and hate crime, all of which now come under the arena or the terms of reference of MATAC. And the first meeting within the new structures took place in August with positive signs in terms of membership and the discussions that took place, and those meetings will continue on a monthly basis from here, reporting back into the Community Safety Partnership. Responsibility for domestic homicide reviews sits with the JCR subgroup, which manages DHR, safeguarding adult reviews and local child safeguarding practice reviews on behalf of the CSP, the adults and the children's partnerships. So as I've already mentioned, funding is allocated annually from the Office of the Police Crime Commissioner, and we also have a proportion of the West Mercia Serious Violence Duty grant and funding, and work is ongoing with the subgroups to allocate that funding. In 2022 to 3, and 23 to 4 financial years, the CSP was underspent on that OPCC grant. So we're really keen this year to make sure that all of that funding is allocated and spent to the benefit and community safety of our local communities in Herefordshire. So far this year, grants have been awarded to the Sanctuary Scheme, which provides support for domestic abuse victims to remain safely in their own homes. A joint project to deliver domestic abuse and sexual violence training through a training programme, the White Ribbon Conference, which will take place in November, and Safe Lives training for chairs of MARAC, that's multi-agency risk assessment conferences, for the governance and attendees of those conferences, which was one of the recommendations from the recent Safe Lives review of the multi-agency approach to domestic abuse within the county. In addition to that, the police are running a Home Office funded hotspot programme where identified hotspots for antisocial behaviour and serious violence are subject to what we call saturation of uniform patrols and in some cases additional problem oriented policing. And there is funding available not just for policing but also to CSP partners to support high visibility patrols by uniform partnership staff. Some funding's already been awarded to Venture for additional street pastor patrols, and the partners that now attend the newly revised MATAC are also considering other opportunities for them to become involved in that. So in terms of performance of the CSP, domestic homicide reviews 9 and 10 were presented at the June meeting. The recommendations were agreed from those that returned to the Home Office. DHR 9 had no learning for the partnership or for single agencies, and DHR 10 has partnership and single agency recommendations, which will be progressed through the joint case review meeting and the DA local partnership, which reports into the CSP. One of the challenges that we faced is establishing a multi-agency data set to support crime profiles for the county. We've had a particular challenge getting data from health, but some is now starting to be received, so the future looks good in that regard. Most recently, we've received our intra-youth serious violence product in June 2024, and that will be discussed at the CSP meeting, which takes place this Friday. The initial findings indicate that there's an increase in intra-youth serious violence from 2021 to 23, but no change in volume since then. And between March and May of 24, 30% of youth serious violence offenders were from out of force. So as a CSP, we'll be discussing on Friday what opportunities we can take for prevention and diversion around those types of offences. There are 6 recommendations in that report, and they will be allocated to the subgroups of the CSP accordingly. And then finally, currently the CSP is supported by staff within the Safeguarding Business Unit, which is funded by the partnership that encompasses CSP, Children's and Adults Safeguarding Boards. In previous years, there was a dedicated role to support the CSP within the business unit. However, that post was removed by Hereford Council in 2023, and a new community resilience team is being created within public health, and that will include a community safety manager, a community safety lead and a community safety coordinator, and they will also look after the emergency planning function. The Community Resilience Manager starts in post in November. Recruitment is underway for the Community Safety Lead, and the CSP has sought to use the PCC's grant funding initially to fund the coordinator role, and the outcome of that bid is awaited. That concludes the report, so I'm happy to take any questions.
Do you have any questions? Yes.
Hi, I don't want to challenge those priorities at all, and they all seem very appropriate. I just wondered if there's been any change in approach over the last 2 or 3 months with the rise in the voice of right-wing groups, and certainly speaking from my own experience, I've had friends and relatives who have been frightened to come out in Herefordshire because of the risks. So I just wondered if there's any. It's not normally an issue in Herefordshire, but race-related issues I think are growing, and an issue for me is that these issues seem to be diminishing over years, but in the last 2 or 3 months they've risen, and it's demonstrated that there is a hidden population of hate and ill will that seems to be being vocalized through Facebook and through other means, and the result is that many minority groups are feeling very fearful at the moment in Herefordshire, and I just wondered if there'd been any change in priority for your group as a result of that.
So that's certainly something that will be on our radar. So the CSP hasn't met since the riots that we saw nationally following the tragic murders in Southport. We do, as I've mentioned, have a hate crime subgroup that reports into MATAC, and that subgroup has asked for some data to be looked at in respect of trying to understand why we have seen a dramatic reduction over the last year in the reporting of hate crime. So once we better understand that, we'll be in a position to have a look at why we've got that underreporting. Is it a fear? Is it a mistrust in services, etc., and take a view from that. In terms of your initial point, in terms of extreme right-wing views, that sits under Prevent and the Contest strategy, which feeds in by exception to the CSP, but is managed under a sort of different strand of the partnership, if you like. But certainly once we have that hate crime product, and that will be part of, from a policing perspective, definitely work on going to engage with ethnically diverse and minority groups within our community, but also more widely across the CSP.
Thoughts on any item? No. Okay, right. When we move then to the recommendation, which it just really is that the Health and Wellbeing Board notes the update report. Have a proposer? Seconder? All those in favour? Thank you. We now move on to the item 11, which is the Herefordshire Safeguarding Adults Board Annual Report. Kevin.
Thank you, Chair. Again, similar my apologies for not being in the room. I'm just back from holiday and I couldn't fit the journey in to get up there in time for the meeting. So I'll aim to be there next time. Again, I'll give you some brief introductory comments to the report, then I'm happy to take comments. I think just worth saying that the board as a whole, I think the last 12 months, as the report said, I think we've made some very positive movements, but we're increasingly talking to each other about the so what question, and as we approach 24-25, what's the impact of the board's work? How can we be sure that it's making a real difference? And we're trying to focus on what we can do better and be a learning partnership. So you'll see even within this annual report, there's a couple of key lines of inquiry that we've highlighted in the annual report for last year that we're going to take forward and are taking forward this year. As a result of what we did last year now, and why I'm mentioning, because things do move on quite quickly. We're doing a lot of work on building on the changes to the front door, working in a multi-agency way. We've really taking seriously the issues of exploitation that are raised in the report and getting the transitions between the children's world and adults world right. The statistics in the report, they come from the ASCOF survey, the national survey. It's quite difficult to do comparisons between authorities because there are different authorities approach in different ways. But in general, I would say that the figures we've got, we should be very proud of. They are indicating a county that takes safeguarding seriously, that has some good outcomes. Particularly pleased with that 91.3% of people receiving services that feel that having those services makes them safe, and that's a very important point. That's a good measure, and that's because that's service users telling us that partners make them feel safe. I draw attention to the drop, what looks like a drop in referrals. Actually, it's not a drop in referrals. What's happened is in health and the safeguarding team is working in a different way. We're doing more triage to ensure that the work that goes through the safeguarding team really does need to be on that pathway, and that's actually been a positive thing, rather than it being any sort of failure to pick up concerns in the community. There are some challenges in the partnership. One of the biggest is capacity. Partners do work hard to support all the working groups, but I'm well aware, working both the children's arena and in the adults arena, and indeed being a member of the Community Safety Partnership, you tend to meet the same colleagues, and it's quite a strain for them to keep the work. Nevertheless, they do try to be there. But to give you an example of how volatile and how fragile we can be, 24-25, we've already had 10 referrals that have had to be considered as safeguarding adult reviews, compared to the 5 that we had for the whole year, and that's an indication of how volatile adult safeguarding can be. So, but overall, I say that figure of those feeling safe is pleasing. Also, alongside the work of the Safeguarding Board, Hillary's been leading the preparation should CQC decide to inspect Herefordshire. And I have to say, if I was looking overall, a lot of that preparation work is showing that Herefordshire as a county is quite a good place to be old or vulnerable. And again, talk community comes out very strongly in everything I've looked at as a really good infrastructure supporting the vulnerable in the communities. During the year, we had some really good some presentations of the good work that's been done on rough sleeping in the county, which has made, I think, a significant impact on those vulnerable on the streets. And the Care Act audit work we did was very positive in terms of showing that each individual partner have good systems and approach to adult safeguarding. The role of the chair of the Adult Safeguarding Board is slightly different than that I do for children, which is the independent scrutineer role. But if I put a little bit of that hat on, I would be giving you assurance that safeguarding structures and the safeguarding partnership for adults in the county is good, and is aware of how to keep good and to continue to progress in the future. I think with those preliminary remarks, Chair, I'll assume people have read the report, and I'm open to any questions or comments.
Jane.
Yeah, just a comment, Kevin, just to back you up on that. I mean, I think it's an area of really good partnership working, and thanks for your chairing of the board, which I think really contributes to that. But no, I think it's an area that we should be proud of. We can never be complacent, but I think we should certainly be proud of it.
Yeah.
Anybody else? I mean, I have to say, not in my official role, but I think as a private individual, if I have the opportunity to speak to anybody that has moved into Herefordshire, I always say what do you think of it as a county compared to where you were before? And the main comment that comes out is that it is a safe place to be, and they are happy for their young people to live in Herefordshire and feel safe in Herefordshire. And I think that is something we should be proud about, but we should never obviously take our foot off the pedal, and we should continue to work hard to make sure that that continues to be the case.
Yeah.
Sorry. That the Health and Wellbeing Board considers the report and discusses the effectiveness of the arrangements for safeguarding adults in Herefordshire, and that we support the report going forward. A proposer? Seconder? All those in favour? Any against? Any abstentions? No. So we move on to item 12, which is the work programme. We've got an updated Health and Wellbeing Board forward plan for 24-25 and 25-26, which has been circulated in the agenda for review by the board. And unless anybody has any concerns about the items on there, on the dates, then I would propose that we accept the updated forward plan. Do I have a seconder for that? All those in favour? Thank you. So that's the end of today's meeting. Thank you very much indeed. The date of the next scheduled meeting is Monday, the 9th of December 2024. But please don't forget the workshop. It's the 8th, isn't it?
It's on the list, actually.
It's on the list. It's
Yeah,
21st of October. Now that meeting is a meeting that it's not a public meeting. That's a meeting where we look in depth at how we've come forward with the health and wellbeing strategy.
Chair, I'll be at the LGA conference. So
okay,
apologies.
We'll give you apologies. Okay. All right. Thank you very much.